absolutely single payer system and Medicare for all break the monopoly of insurance companies. We need to negotiate with pharmaceutical companies directly. These are the things that we have to do in order for a healthcare system that is equitable, that will come together. Affordable childcare is a must. They have decided that they're going to release that fund that's been set aside for quite some time, and that is actually generated by commercial lease. It's making sure that these corporations pay their fair share. That is how we're going to fund affordable childcare. Federal government needs to invest in building more housing, not just for low income, but to actually recognize workforce housing should be part of the equation. For our teachers, nurses, first responders, we need to expand that criteria and the income level for the federal government to be able to cover. It's a whole list of investments the federal government can actually do.
For housing, we've worked to break down the barriers. Permitting, it should not take you years to get a permit. We have to zone for enough new homes. On healthcare, we need to continue to expand access by forcing insurance companies to cover more care and to get rid of things like prior authorizations, to reduce the cost of prescription drugs by making sure the generics market is robust and we don't have patent abuse, and then ultimately move to Medicare for all. People's health insurance should not be based on whether they have a job and where they work. And then we have to have universal childcare. When we talk about the cost of living and the stress on middle income and working class families, so much of that is about childcare. And those three things alone, there are other things, but housing, healthcare, and childcare, and then we put paid family leave on top of it, that will be transformative for so many people's lives.
I'm a big supporter of Medicare for all, but I actually believe that's just the first step. What we have with our healthcare system is not just an insurance problem, but we also have a healthcare access problem. 80% of the counties in America don't have access to high quality healthcare. So we actually need to go beyond Medicare for all to creating a truly national healthcare system by having the government directly provide healthcare in those places. On childcare, we have to do a universal childcare program. I've got a larger national housing plan. We actually need to make it legal to build social housing again in this country. Currently, that's not legal. I have a plan for recreating something called the Reconstruction Finance Corporation. It was a state-owned corporation that we had during the New Deal and the World War II era. While we're building housing, we got to make sure there's no displacement. And the final piece of this, we have to actually ban the speculation in our housing market. And we have to actually go after predatory corporate landlords. And when you have essentials that are becoming more and more expensive, we should be building the capacity as a state to just provide those essentials directly.